All of us have at some point of time come across the term diabetes reversal on at least online on social media. So a lot of you are interested and would actually try to find out whether diabetes is reversal. Is there a possibility that you go off drugs? Now, to understand that better, all these years we have always known that diabetes is a persistent and progressive illness, that with increasing duration of the disease, with increasing time, the beta cell function gradually declines, and most often patients have to intensify therapy. They have to move on from one drug to multiple drugs, and a lot of them will need insulin injections also eventually. So the first question is diabetes a reversible illness at all? Should we even think of a reversal? So in this context, probably reversal is not an appropriate word. A more appropriate word could be diabetes remission. That is a temporary state where a patient could reduce diabetes medications or maybe even temporarily go off them and still maintain a good glucose control. So how is that possible? Remember, all this applies primarily to type 2 diabetes. No patient with type 1 diabetes should be hoping for or trying to attempt a reversal. So in type 2 diabetes, very often there is calorie excess, and this leads to excess fat deposition in the liver and also in the pancreas. So excess fat in the liver leads to increased insulin resistance in the liver, which increases the liver glucose output. Similarly, when there is excess fat in the pancreas, this affects the pancreatic beta cell function and reduces insulin secretion. Both of these contribute to the pathophysiology of type 2 diabetes mellitus. So when patients lose significant amounts of weight, obviously with lifestyle, with diet and exercise, there's reduced hepatic and pancreatic fat content, and this leads to decreased liver glucose output and actually improved beta cell function. This may translate in some of the patients as decreased requirement. In fact, all of them improve glucose control, certainly with weight loss, but some may be able to reduce medications and a small fraction might be able to go off medications, which is actually called as remissions. So basically, remissions are achieved after significant glucose control. Now, it is important to understand that remissions may not be possible in all the patients. It depends not only on the quantity of weight loss, but also on the duration of disease. Durability of the remission also depends upon how long the patient had the disease. So for patients who have had diabetes for say 15 to 20 years, it might not be appropriate to hope for a remission. Yet glucose control inevitably improves with fat loss. So all those patients who have actually entered a phase where they have gone off drugs must also understand that this is likely to be a temporary phase. They should not assume this to be a cure. Hence, they need to keep testing for glucoses periodically, and as and when the glucoses rise, they must be open to the idea that they might need medications again. So yes, remissions are possible, but it all has to be guided and it all has to be under the supervision of your physician or your endocrinologist. Thank you.